welcome to this sixth video of our series of dialogues between global commissioners on drug policy and people who use drugs. I have with me today from Sydney, Commissioner Geoff Gallop, who was the 27th Premier of Western Australia, and Angela McBride, the Executive Director of the South African Network of People Who Use Drugs. Angela has worked in the field of harm reduction for over 5 years. Over to you both.
Good morning, Geoff. Thank you so much. So one of the lockdown regulations in South Africa was the prohibition of alcohol and cigarettes. What does prohibition look like for you?
Well, when I think of prohibition, I think of failed policy. And it's failed, I guess, for two reasons. The one failure that comes to mind is unwarranted and inappropriate and unethical incarceration of people. The second thing, I guess, I see is a policy that just simply isn't delivering on the objectives that it claims to have, which is to reduce the amount of drug use in our community. That is not happening, and it's not happening for a whole range of reasons. So when I think of prohibition, I think of people being inappropriately caught up in the criminal system. Some of those people, and many of those people, in fact, going to jail, increasingly women who suffer from the double inequality. On the one hand, there's many societies where, sexism is still very prevalent. And then on the other hand, there are also drug users where there's stigma. So they have to cop it twice. So it's a failed policy. And I think we could do a lot better as a community to deal with drug use.
I agree 110%. To simply pick someone up and throw them in prison is just increasing their harm. So if you were to provide any suggestions or feedback from your experience to me as a young woman starting in the field of harm reduction and activism, what advice could you give?
I think that in the way that public policy works, opportunities emerge from time to time, even in an environment which has previously been very, very difficult to manage if you're a reformer. So normally you might say, look, it's very hard to convince people to make a rational change. They're full of prejudice, they're full of stigma, etc. But along come circumstances. And as you know, in Portugal, towards the end of last century, circumstances came where they had a major crisis that was affecting them right across their society. And they acted. They took the opportunity that was available. Here in Australia at the moment, let me illustrate that with two very smaller examples. ICE has been a big issue debated. There's been a couple of inquiries in Parliament, and they're recommending diversionary systems rather than criminalisation. That's an issue, and one of the parliaments has come up with some ideas. Whether they will be introduced, I don't know. The other one is drug testing in concerts, where young people attend the concerts to have drug testing. It's very interesting if you look around the world in some of the struggles that have occurred over reform policies. The courts are very interesting on these issues. They can be quite important weapons, as you've found in South Africa with the decision of the Supreme Court in relation to privacy. That in the privacy of your own home, people should be able to smoke cannabis and have a few plants, etc. In Canada, this became a big issue with their injecting centre in Vancouver, where the High Court of Canada ruled that it was a health issue, and the efforts of the Conservative government there to shut down that centre was against their constitution. So I think you need to look at all, and you're an activist, you're involved in all of these things. So grab those opportunities when they come. They don't always come, but when they do, if you're not ready for it and you're not got your systems in place and your supporters in place, you're going to perhaps miss the opportunity to make a change.
And when you say systems in place, what does that look like?
What I actually mean is have a good support base, particularly from the families of people who perhaps, as a result of a lack of a particular service, lost their loved ones. So I think, get the families, make sure they're part of your team. That is a very effective system that you can have in place. Secondly, you've just got to keep knocking on the door of all of the politicians and let them know what the reality is. It's most important that the people who use drugs get together as a community to press their points with the authorities, to make sure people know about their lived experience, but also to help each other. And that's what we've found in the COVID-19 crisis. A lot of that social support within the drug-using population itself has been very important. So well done, and keep up the good work.
Thank you so much, Geoff, for taking the time. I know that we all have very busy lives, but I really appreciate you taking the time to chat to me and share your experience with me. It's really comforting to know that there are, no matter where in the world we are, there are people who are fighting the same fight, although at different paces. But I do appreciate you sharing your time and your experience with me. I know how precious time is, so thank you.
Thank you very much for being with us today on this edition of our dialogue series. Stay tuned for our next episodes.
Thank you.
Thank you.